Hello, dear colleagues. Welcome to our today's surgical case. This procedure involved the excision of ganglion cyst on the dorsum of the left hand in 14-year-old female patient. The patient had previously undergone conservative management, including steroid injection, but the cyst persisted, necessitating the surgical intervention. We begin with scrubbing and wrapping the patient following the standard aseptic technique to ensure a sterile environment. This reduces the risk of infection and provides a clean surgical field. Local anesthesia is now administered to ensure the patient is comfortable throughout the procedure. A combination of lidocaine and epinephrine is injected to provide both local pain relief and vasoconstriction, minimizing the bleeding during the dissection. Once anesthesia has taken the effect, we make a longitudinal incision over the ganglion cyst, which is typically located along the dorsum of the hand. The incision is planned so that we can expose the cyst while minimizing the cosmetic concerns. The first layer we encounter is the skin. The skin is carefully retracted using a sterile instrument to expose the underlying structures. Next, we start dissecting through the superficial fascia, which lies just beneath the skin. This layer is relatively thin but important as it separates the skin from the deeper structures. Now we are doing some blunt dissections. We will release adhesion from all around. We continue through the extensor retinaculum, a fibrous structure that holds the tendons of the extensor muscle in place. The retinaculum is gently opened to expose the deeper layers. This is a critical step because the cyst lies near the tendon of external digitorum communis. We carefully separate the cyst from the surrounding soft tissues, ensuring that we do not damage any tendons or nerves in the process. The tendon of extensor muscles are particularly important to protect, as injury to them can result in functional impairment of hand movement. Now I am trying to locate the capsule of ganglion cyst beneath the tendons. Upon identifying the ganglion cyst, we see its characteristic cystic structure filled with a gelatinous viscous fluid. Now, the cyst is gently separated from the surrounding soft tissues. It is important to ensure complete removal of both the cyst wall and the fluid filled content to reduce the chance of recurrence. Now, this is the capsule of the cyst, which is removed entirely. After cyst removal, we irrigate the wound thoroughly with sterile saline to remove any residual fluid and debris. Now we will start approximating the subcutaneous tissues with the observable suture. Now we will take some sutures and subcutaneous tissue to reduce the dead space and minimize the risk of hematoma formation. Finally, the skin is closed with fine non-absorbable suture to ensure proper alignment and cosmetically optimal result. Thank you for watching this surgical excision of a ganglion cyst. These cysts are benign but can cause discomfort and functional impairment, especially if they are located near tendons and nerves. This patient is expected to make a full recovery. Steroid dressing is applied and the patient is provided with detailed post-operative instructions.